All right, buckle up, everybody, because today
We're diving deep.
into the world of ligament injuries.
And this is one deep dive.
I have a feeling you're going to want to pay attention to.
Because who hasn't twisted an ankle?
Or known someone sidelined
Right.
by a knee injury.
Yeah, you're absolutely right. Yeah. These injuries are incredibly common.
Yeah.
And the more we learn about ligaments,
The more we realize they're not as simple as they seem.
yeah, I'll admit,
I used to think of ligaments like rubber bands.
just holding our bones together.
But something tells me it's a bit more complicated than that.
It's a great place to start.
But ligaments are far more intricate
Think of them less like a rubber band.
and more like a complexly woven rope
They're made up of these tough, fibrous collagen strands,
that are actually designed to tear in different ways.
depending on the force they experience.
So you're saying there are different ways a ligament can fail.
Absolutely.
I'm intrigued
You can break it down.
into three main types of ligament failure.
Abrupt, progressive, and interstitial.
Okay.
Let's picture a football player.
Taking a massive hit to the knee.
Sudden tear in their medial collateral ligament, or MCL.
That's your classic abrupt failure.
Okay, that makes sense.
A sudden force.
Causing an immediate tear.
So what would be an example of a progressive failure?
Imagine a tennis player.
Who's been putting stress on their knee with every serve and volley.
Over time, the fibers in their anterior cruciate ligament, or ACL,
Start to fray and fail.
leading to a progressive failure.
So instead of one big snap.
It's more like a rope slowly unraveling.
That's a great way.
That actually makes a lot of sense.
That's a great way to put it.
And to really understand how ligaments respond to force,
We can look at something called a stress-strain curve.
imagine you're stretching a rubber band.
Okay.
At first, it stretches easily.
But pull harder and it resists more.
Keep pulling, and eventually it snaps.
Ligaments behave similarly.
So there's a limit to how much stress they can handle
Precisely.
before they reach a breaking point.
But what's fascinating,
Is that this limit isn't set in stone?
several factors influence a ligament's strength.
For example, size matters.
Thicker ligaments are naturally stronger.
That seems intuitive enough.
What else plays a role?
Well, remember the use it or lose it principle.
It applies to ligaments too.
Keeping active is key because immobilization actually weakens them over time.
Wow. I never realized that staying active was so important for ligament health.
Exactly.
It's like they thrive on being used.
However,
We can't ignore the effects of aging.
I was afraid you were going to say that.
As we get older.
Our ligaments naturally become less resilient, just like many other parts of our body.
But it's good to be reminded.
Are there any other surprising factors that affect ligament strength?
You might be surprised to learn
That certain medications, like steroids,
can have a dual effect on ligaments,
okay,
while they can sometimes aid in the healing process.
they can also weaken ligaments if used improperly.
It's a delicate balance.
Okay, so there's a lot more to ligament strength than meets the eye.
But let's say someone does injure their knee.
What happens then?
How do doctors figure out which ligament is injured and how bad it is?
So let's say we're on the sidelines
Of a basketball game.
and someone lands awkwardly after a jump shot. They
Right.
grab their knee in pain.
What happens next?
You're right there with me.
That moment of impact can tell us a lot.
But to really understand the extent of a potential ligament injury,
Doctors rely on something called instability tests.
okay,
It's like detective work for the knee.
I'm all about some medical mysteries.
What exactly are instability tests?
And what are we trying to solve?
Essentially, these tests help us determine which ligaments are affected.
And how badly they're injured.
They involve applying specific forces to the knee joint.
To see how it responds compared to a healthy knee.
So it's about looking for any unusual movement or looseness in the joint.
Exactly. Now picture this.
One of the most common knee ligament injuries we see,
Involves the anteromedial part of the knee.
anteromedial.
That sounds pretty technical.
You got it?
Think of it this way. Antero refers to the front,
And medial refers to the inner side.
so the anteromedial part of your knee.
Is that area on the inside towards the front?
Okay.
So it's that vulnerable area on the inside of the knee.
I've seen athletes take some nasty hits to that spot.
How does that area usually get injured?
Let's go back to that basketball player
Imagine they jump up for a rebound.
and land with their foot planted awkwardly while another player crashes into their outer knee,
This creates what's called a valgus stress.
basically pushing the knee inward.
Okay.
Combine that with a natural tendency for the body to rotate outward during sports.
And it puts a tremendous amount of stress on the ligaments in that anteromedial region.
So you've got that inward force and a twisting motion happening simultaneously.
No wonder that area is prone to injury.
It's a recipe for trouble.
Now to diagnose exactly what's going on.
Doctors use those instability tests we were talking about.
All right, let's get into the nitty-gritty.
What are some of the specific tests used to diagnose these injuries?
Well, a classic one is the valgus stress test.
Here, the doctor gently bends the knee and applies a slight inward force.
Checking for any excessive movement.
This helps isolate the medial collateral ligament, or MCL.
We also have the varus stress test, which does the opposite.
Applying a gentle outward force to examine the lateral collateral ligament, or LCL.
So it's like checking the side-to-side stability of the knee.
Isolating those key ligaments on the inner and outer sides.
What about the ligaments that run through the middle of the knee?
The ACL and PCL.
How do you test those?
Great question.
For those, we use the anterior and posterior drawer tests.
The examiner gently pulls and pushes on the shin bone with the knee bent.
Oh, okay.
If the shin moves too far forward.
It suggests a possible injury to the anterior cruciate ligament, or ACL.
Similarly, excessive backward movement could point to a problem with the posterior cruciate ligament, or PCL.
That makes sense.
So it's all about feeling for that telltale looseness in the joint.
You're spot on.
It's not just about how far the joint moves,
But also how it feels at the end of that movement.
a firm endpoint, even with some instability, might indicate a partial tear.
But if it feels mushy or like there's no resistance...
That's a red flag for a complete tear.
That's fascinating.
It's like those subtle differences in movement can reveal a whole lot about the extent of the injury.
You got it.
And we can't forget about rotational instability.
Which is where the pivot shift test comes in.
It's a bit more complex.
But essentially, it involves bending the knee and applying a twisting force.
A positive pivot shift test
While not a pleasant experience for the patient.
helps confirm if the knee is unstable during rotation.
Okay, I'm definitely adding that one to the list of tests I never want to experience.
It sounds like diagnosing ligament injuries requires a lot of expertise and careful observation.
Absolutely.
Even experienced doctors might interpret these tests slightly differently,
That's why it's crucial to consider the patient's history symptoms.
and other factors before making a diagnosis.
So you've diagnosed the injury.
And now it's time for treatment.
What happens next?
What are some of the common approaches to help these injuries heal properly?
All right, so we've walked through those nail-biting moments.
Of injury and diagnosis.
But what happens next?
What can be done?
To help those ligaments heal and get people back in the game.
That's where treatment comes in. And one of the most common approaches, especially in those early stages, is using orthotics. We're talking about braces and supports, right?
Exactly.
Those things you see athletes wearing all the time.
Orthotics play a crucial role in supporting injured ligaments as they heal.
Think of them like a temporary cast for your knee or ankle.
They help limit movement in specific directions, taking the stress off those injured ligaments and allowing them to knit back together.
So it's like giving those ligaments a break while they recover.
So are we talking about those basic drugstore braces?
Or are there different levels of orthotic support?
It's a bit like choosing the right tool for the job. It all depends on the severity and type of injury.
For minor sprains, a simple off-the-shelf brace might do the trick.
It's like putting a little splint on a sprained finger.
Makes sense.
But what about more serious injuries?
Say an athlete who needs to get back to peak performance.
That's where things get really interesting for athletes or those with more complex injuries. We often recommend custom-molded orthotics.
These are like the high-tech, tailor-made suits of the bracing world.
Custom-molded.
Precisely.
So they're designed specifically for that person's body.
We're talking about taking molds of the individual's leg to create a brace that fits perfectly.
Providing targeted support and control.
That's incredible. It's like having a brace engineered just for you.
But I have to ask, are there any downsides to wearing a brace?
Don't they sometimes get a bad rap for weakening muscles?
That's a common concern, and it's important to address. While orthotics are incredibly valuable, it's all about finding the right balance like anything else.
Too much of a good thing can have its drawbacks.
So it's not a set it and forget it situation.
Exactly. If a brace is worn for too long, or if it's too restrictive, it can lead to muscle atrophy or stiffness.
Think about it. If you wear a cast for months, your muscles will naturally weaken from lack of use.
That makes perfect sense.
So it's a dance between providing support and making sure those muscles stay active.
It's crucial to work closely with a healthcare professional. They can help determine the appropriate level of support and create a plan to gradually wean you off the brace as the injury heals.
We want to support the healing process without hindering the body's natural ability to recover.
It's like that old saying.
A little help goes a long way.
But you don't want to rely on it forever.
Exactly. And let's not forget about range of motion.
Right.
That's another key consideration with orthotics.
You don't want a brace that prevents you from moving your joint properly.
Absolutely. Some braces are designed to allow for a full range of motion while still providing support, while others are more restrictive.
It's about finding the right balance between stability and mobility, depending on the injury and the individual's needs.
It sounds like patient education is so important here.
Making sure people understand how to use their brace correctly.
Couldn't agree. More comfort and compliance are key.
If a brace is uncomfortable or inconvenient to wear, people are less likely to use it consistently, which can sabotage their recovery.
So it's a team effort.
The doctor, the patient, and the brace all working together.
Now you're getting it. It's a collaboration to get that athlete or anyone really back to doing what they love.
This has been an eye-opening journey into the world of ligament injuries.
We've covered so much ground from those initial mechanisms of injury to the fascinating world of diagnosis and treatment.
It's amazing how much complexity there is in these injuries that we often take for granted.
And the human body's ability to heal and adapt never ceases to amaze me as we wrap up this deep dive.
Any final thoughts for our listeners?
If there's one thing to take away from this, it's that ligament injuries are more nuanced than we often realize.
Understanding the different types of injuries, the importance of proper diagnosis, and the role of orthotics in recovery can make all the difference in getting people back on their feet and back to doing what they love safely and effectively.
Couldn't have said it better myself. Thanks for joining us on this incredible deep dive into ligament injuries. Until next time, keep those bodies moving and those minds curious.